think we'll finish off on one final insurance question, Allanah, and around taking control. I think COVID's taught us without health, you've got nothing. Maybe touch on what you've been seeing in the market with, why are more people taking up health insurance and kind of how does it work?
Yeah, I think COVID and what we've been through in the last couple of years has highlighted health and put health at the forefront of people's concerns. So health insurance is vitally important. And the aftermath of COVID is that the healthcare system is significantly delayed. So waiting lists are getting longer, people are waiting for treatment. It has highlighted the importance of getting good care as well. So with a private health insurance policy, you can get all those things. You can take control, you can see the doctor you want to see, you can see the specialist you want to see, you can see get a second opinion. So there's a lot more choice there. And I think that's on people's minds at the moment, yeah.
Yeah, you probably get some people that say, well, look, ACC, I'm sweet.
Yeah.
How do you tackle that?
So ACC is great, like ACC does pay and it's a great fallback plan, but it's not a surety. Supplementing ACC with private healthcare is important. It is common knowledge that ACC only pays for accidents, not illnesses, and illnesses can have a great impact to your financial situation. So when it comes to like major diagnosis like cancer, there's a lot of imaging that takes place before you even get treatment. So you're paying for multiple MRIs, multiple CAT scans throughout that process. You're paying for radiation treatment, chemotherapy, drugs. There's a big cost involved. And while the public system can cover things like that, it really depends on where you catch the illness. Like if you're well into it, the public wait list might put you past your expiration date. Like you might need treatment much quicker than that. So yeah, as far as ACC, it doesn't cover things that are unexplainable. So you might think of like an aching back as an injury, you think ACC should pay for that, but if it's not directly correlated to an actual accident, then it's not covered. And
I imagine that can be quite grey sometimes.
Yeah, definitely. So I recently came across a guy who was in his 60s, had a knee injury in his 20s, and he thought he should get paid ACC for that because it was connected to the knee injury in his 20s, and he should. The good news for him was he had private health care. He was able to get a knee replacement surgery right away. And now the private insurer is fighting on his behalf to recoup that money from ACC. So while you might be covered for ACC, the private health care can jump in, get you the cover you need when you need it, and help you get back to living life sooner.
Which is huge, because if you've got a knee replacement for 18, 24 months, your life is essentially on hold and in pain. So
definitely.
Yeah,
definitely.
That's huge.
And especially around here, a lot of us are active, love the outdoors, like that gives life and meaning to a lot of us. So you need your body for that. So getting repaired and getting the treatment you need and getting back to the things you love is important.